We'll draw the slack toward the buttocks, pressure against the tissue, a little extra pressure with my middle finger, and bring the muscle to move around toward the spine and back to the scapula. Slack toward the buttocks, another C-shape moved over the top border of the rhomboids, and then rock the thumb over the trapezius. Now, to do this same procedure from the client's right side, we will switch hands, and we'll be using our left hand to draw the slack and the right hand to make the move. So now my right hand is on the top, my fingers are on the top of the trapezius, my thumb is on the edge of the scapula. I'm going to take my middle finger of my left hand, draw the slack toward the table, toward the buttocks, pressure with my thumb, place my finger back on the thumb and make the C-shaped curve, arcing move toward the spine and back to the edge of the scapula. Fingers back, thumb pressure off, slack toward the buttocks, thumb back down on the tissue, second move over the rhomboids, slack toward the buttocks, bring the thumb back over the top of the trapezius. That completes moves 10, 11, and 12. And also that completes part B of basic relaxation move number 2. Now, while the client is in this position, before turning them over in a supine position, I'll start the kidney part A moves, which are the same moves as we did on moves 1, 2 of procedure 1, and the same moves as 1, 2, 3, 4 procedure number 2. But the only difference with these moves is the first moves are the slack is toward me, and the move is toward the spine with my thumbs. My fingers are taking the slack away and making the move toward the spine. That's 1 and 2. Now number 3, I'm going to start away from on the lateral side of the erector spinae muscle, and I'm going to take the slack medial, and I'm going to make a move outward from medial to lateral. And I'm going to take my fingers and I'm going to pull the fascia and the skin toward me to take the slack, and I'm going to push over the muscle laterally to make moves 3 and 4. And 5 and 6 are medial moves, just like the first one. 5, my fingers are pushing the slack away, moves over the muscle. And then 7 and 8 moves are slack in with my thumbs, and the move is out laterally, and move 8 is slack medial, and the move is lateral. And that finishes part A of the kidney procedure. Immediately following that, I will usually do the part A of the hamstrings. Part A of the hamstrings, I'm going to grasp the ankle with my thumb and forefinger of my right hand. I'm going to take the fingers of my left hand, or I can use my elbow with gentle pressure with my hand facing the foot, and I can take, I'm in the middle of the thigh, and I'm going to pull the slack laterally with my elbow, and I'm going to press down and in a little at the same time and make a medial move over the hamstrings. Or I can use my 2 fingers, and I can put them in the middle of the thigh, just below the gluteal fold, pull the slack laterally and make a medial move with my fingertips. Next, I use the thumb and the flat of the thumb of the left hand and the popliteal fossa, which is the soft spot just behind the knee. And not too much pressure is exerted here. With this move, we drop the foot down just slightly, and I'll make the slack will come laterally under my thumb toward me, and then I will make a small medial move over the popliteal space. For number 2. Number 3, we call this making the foot kind of stupid. That's Milton's old phrase. You can wiggle the foot and the ankle back and forth, up and down for 5, 10, 15 seconds to get everything all relaxed and released and friendly. And then we're going to take the fist of the right hand and give one sharp rap to the ball of the foot. Make sure you stay on the pad of the foot. Don't hit down in the arch and don't hit on the toes. We'll go one sharp rap right on the ball of the foot, which sets the hamstrings. We gently put the foot back down to the tabletop and move over to the right side and proceed. Repeat this process. On the right side, I'll use my fingers. And I'm going to pull the slack toward the medial laterally, and I'm going to make a medial move. Take my thumb, and I make the slack laterally, and make the move medial. And grasp the ankle, move the foot, make it stupid. One sharp wrap on the ball of the foot. That's part A of the hamstrings. So far we've done part A of the hamstrings, part A of the kidney. Because there's a part A, there's always a part B, but that will be done when we turn the client over. While the client's lying on the prone position, I can do the sacral procedure. The sacral procedure can also be done standing up with the client leaning against the wall, or it can be done in a prone position. We palpate with our thumb the tip of the coccyx with the left hand on the left side, and bring the forefinger up to about 11 o'clock, which would be right around over the sacral notch. We will take the forefinger and push the slack toward the shoulder, and we will make an inferior move back toward the buttocks, and we will take the finger and release the pressure, keeping the finger in the same point, and then reapply the pressure. At the same time, take the left thumb, slack toward the tabletop, and a posterior move over the tensor fasciae lata, and that's the same move as we did in basic relaxation procedure number 1, 2, which would be moves 3 and moves 4. Only instead of using 2 hands, we're just using the 1 thumb. And we repeat that process on the right side using the left hand, using the right hand. And this, my finger goes to about a 1 o'clock position to the sacral notch. Skin slack goes superiorly, and the move comes inferior. And then I swing and rotate my thumb down to the side of the hip, and I take the slack toward the tabletop, and I make a posterior move over the tensor fasciae lata. While the client's still in the prone position, before turning her over, I can finish the kidney. I'm going to grasp the foot and ankle and bend the leg to a 90 degree. I'm going to place my hand over the erector spinae muscle, and I'm going to be angling just at the same angle as the rib cage. I'm going to rotate the leg externally until the right hip starts to come off the table. I'm going to have her turn her head to the left, please, and tuck your chin to your shoulder. That gets everything all relaxed. And then with my left hand, the flat of my fingers on the erector spinae, I'm going to take the slack toward the spine, and I'm going to make an inferior move oblique and down toward the right hip. While she's in this position and she's got her chin tucked, I'll do part A of the respiratory procedure, aka asthma. And this is over the erector spinae muscles in the same location that we did moves 1, 2, 3, 4 in basic relaxation procedure 2. Again, using the flats of the fingers, the slack is taken lateral toward the shoulder blade while the hip is engaged, and the move is made medially for the first move, which is a reflex move, and the second move is the actual move, and the skin slack is taken toward the spine, and the move is made laterally. Then we slowly put the leg back to the floor, to the tabletop, and we flex the opposite leg, turn your head to the opposite side for ease. And we're going to, again, repeat that process on the left side, moving the right leg outward. Slack lateral, move medial, which is a reflex move. Slack medial, move lateral, which is the actual respiratory move for part A. While the client's still lying on the prone position, we can palpate the finger with our thumb